All right.
My name is Brad Brimhall. I'm a physician. I work currently at the University of Mississippi Hospital System, and I work both doing functions sort of as a hospital administrator, but also as a physician in the Department of Pathology and Laboratory Medicine. And I came to Informs because of the analytics part of what the organization is doing, and that's going to be very important for us as physicians and for hospital administrators and for payers and all the people involved in the hospital value chain for us to determine the value, is what we're doing the right thing. It's not just, are the processes optimized, but is the actual transfer of information optimized? So that's where analytics comes in as a very important function for us to do. And it's interesting to me because I like numbers. I've only had one operations research class in my entire life, and that was when I was getting my master's in public health at Harvard in Boston. And it was from a professor who taught a class in evidence-based medicine, so I didn't even take it out of an initial interest, but it was just because I loved the professor so much. I took it from Dr. Joe Pliskin, and I did learn a lot in the class, and I learned a lot about the function of mathematics and optimizing processes. I won't pretend to understand it nearly as well as as my OR colleagues do, but I can at least have some basic understanding of what they do. And on the analytics front, I actually have got my hands dirty and done a lot of analytics work both in this job and previous jobs and with collaborators around the country and even overseas. And I just love data. I love what data can tell us if we look at it correctly. And I see tremendous potential for financial savings, for better patient outcomes, at a time when healthcare is crying out for those things to happen, especially in the United States.
You want to tell us a little bit about your project?
Yes. Yeah, let's look at the project here. We actually are trying to build a simplified data model for us to get data from finance sources, from clinical sources, from operational sources, and from outside documents into a single database. And we're using previous work we did to show the financial justification for it. Previous work we did in New Mexico showed a huge amount of savings for this integrated delivery system of about $716,000 per year, just looking at 7 test combinations, and that's actual cost savings. If we only look at the variable cost and the labor cost, the direct labor cost, it's a little bit over $500,000 in savings. We estimate there's at least 40,000 different test to clinical question combinations that can be asked. We're not planning on analyzing all 40,000 anytime soon, but we've analyzed 7. We've already found $500,000 in variable plus labor savings. We're hoping to use that to show that there needs to be more focus placed on analytics in the healthcare arena, particularly with respect to utilization of laboratory tests and pathology tests. I imagine this would also apply to radiology and all of the other services that we provide in the healthcare arena. They need to be analyzed and looked at carefully, and that's where analytics is very important. And so that's why we did our work, is to show the financial impact and to make a case to hospital administrators, to payers, of why they should be focusing on this.
Great, thank you.
Sure. Did that work more or less?